Hey everybody, this is Elliot. I'm here with Dr. Steven Cyr. I just thought I'd pull out my cell phone and video some information, especially on some of the products I've been taking. I get asked all the time, my workout regimen and everything else when it comes to vitamins and diet. You know, one of the best advices I've ever heard is that you can't outrun a bad diet. Your immune system needs to increase to be strong, especially during these times. But I have the man behind the scenes when it comes to vitamin C, when it comes to beetroot, when it comes to COQ10, which I really want to know about. Some of these I take, but I haven't taken everything. But tell me a little bit about this. What's going on, man?
Yeah, so CRMD Nutrition I started because I had so many patients asking me about nutrition. You know, they know that I live a healthy lifestyle and I've always been into bodybuilding and fitness. And they asked me what supplements to get and where do they get them. And so I got to the point where I just decided I would create my own line and show them what I like. And I vetted all of the products and made sure that everything that was in the product was something that I'd put in my own body. So a lot of these products are natural. The key to most of these products is that they work and they're affordable. A lot of vitamins are really expensive. So one of the things that I think everybody needs to know about right now, and I did make a post about this on my personal page not too long ago, is how do you protect yourself from infection, from viruses, especially COVID. Right now there's another outbreak, there's another variant that everybody's battling. The hospitals are filling up again, and we're having a hard time getting our patients into surgery because the hospitals are full of patients with COVID, and praying for them and their families, number one. But how do you protect yourself from that? And if you get COVID, what do you do? So what I tell all my patients and all my friends is that number one, you need to be on a vitamin regimen that helps prevent you from getting the disastrous effects of being infected, because you're gonna probably get infected. And if you wanna avoid getting infected, and when you get affected, you wanna have a minimal result and not end up in the ICU, then one of the best ways to do that is to boost your vitamin D. Vitamin D3 is really important. In countries where they have high vitamin D levels because they're exposed to the sun all the time, the number of COVID patients is far less and the severity of their symptoms is far less. We're actually using vitamin D right now in the ICUs and in the hospitals to treat our patients at 10,000 units per day. And guess what this is? 10,000 units. So this is exactly what we're using in the hospital. Vitamin C is another huge one. Every day I do vitamin C, even when I'm totally normal and healthy. I take 3 grams, which is 3,000 milligrams of vitamin C. When you have COVID, people recommend 5,000 to 10,000 grams of vitamin C. So, you know, this is, again, what we use in the ICU nowadays. We've learned a lot more about how this virus responds to treatment. So the medicine doctors are using vitamin C and vitamin D in addition to remdesivir and just the supportive care that everybody knows about to get patients better. But vitamin C and vitamin D are huge and important in the arsenal against infection, especially COVID. And then another one that a lot of people don't know about is vitamin A, and then of course ours also has zinc for the same reason. We want to boost your immunity. Vitamin A helps create kind of a block around the cells so the viruses can't get in there and multiply and make us really ill. So vitamin A, vitamin D, vitamin C are key. The other one that a lot of people don't know about is beetroot. Beetroot is huge because what beetroot does is it dilates your blood vessels. And those of us who have been in the bodybuilding world know about nitric oxide for years. I have always taken nitric oxide before a workout because it boosts your endurance. And it also boosts your immune system because what happens is it dilates the blood vessels. So the blood vessels throughout your body become bigger, which means they carry more blood, which carries more oxygen. And when you have oxygen to your cells and to your lungs and to your system in general, several things happen. One is your immune system is boosted, your ability to build muscle and to have increased endurance is improved. Your blood pressure, believe it or not, people that have high blood pressure, they sometimes will take beetroot and have to get off their blood pressure medicine. Oh, go figure. But that's amazing because it's a benefit to the medicine side of the world where you can get rid of your prescriptions sometimes. So at the very minimum, you might be able to drop your dose, but beetroot helps with our blood pressure, helps with oxygenation of our lungs because it's bringing oxygen, right? So our lungs fill our body with oxygen, and then that oxygen goes into our system, it goes into our arteries, it fills and feeds all of our vessels and our tissue. So beetroot is huge. It helps our lungs do their job. And then of course the joint complex, if you're working out and you're in your 40s and 50s. I'm
47, 50, I feel it.
50. So we're still fighting the good fight. But when you're 50, you got to take something for your joints. So our joint complex has glucosamine and chondroitin and MSM, and they've been shown in medical studies to actually help inhibit pain and to help boost and build your cartilage so that your knees and your joints and even your spine, which is made of cartilage and collagen as well, it helps boost all of that. And our bone is made of collagen as well. So, you know, collagen is huge. It helps with our skin, helps with our hair, helps with our nails, it helps with our joints, helps with our spinal health. So collagen, joint complex is really important.
This one, your wife was telling me about this one. I haven't used it, but
Yeah,
she was,
CoQ10, you know, a lot of people don't take or know about CoQ10, ubiquinol or ubiquinone. There's different names for it, but ours is called CoQ10. It's ubiquinol, and what's good about CoQ10 is that it has a lot of benefits in our body. One is that it helps decrease fat retention, so you gain less fat. It helps break down stored fat, lipolysis, so it breaks down stored fat. So it has a weight loss benefit. But one of the main benefits is that it works. I took it for a little while and I was wondering why I was just dropping weight. I wasn't trying to drop weight, I was just dropping weight. Nothing in my diet, nothing with my supplements had changed except I started implementing CoQ10 and I started losing weight. I actually lost 10 pounds that I didn't want to lose, you know, and so you got to be careful. If you want to lose weight, it's a good one, but it also improves your mitochondrial function. Mitochondria are the organelles in our body that are responsible for cellular respiration and energy production. So it helps our cells to become more energetic and to function more effectively. So this is good for a lot of things. It helps with diabetes, it helps with your heart health, it helps with your cellular functioning, so it helps battle aging. So it's really good for you in general. These supplements are almost a necessary daily thing. And if we don't get enough in our diet, which almost none of us do, it's almost impossible to get what we need, especially when it comes to vitamin D3. You have to get these things through supplementation. And then the other one that I really love is our whey protein. I've been drinking whey protein since we used to drink Mega Mass and throw up every time because it tasted so bad. But whey protein has advanced a lot over the years, and one of the ways that it's advanced is that it tastes really good and it mixes really well, even with water. So our whey protein, what's special about our whey protein is that it has an enzyme called prohydrolase, and prohydrolase digests the enzyme, the protein in the protein powder. So what it does is it makes it more absorptive, right? So as it's becoming more bioavailable, it has up to 55 times more absorption because of the prohydrolase. So it's a more effective protein. It has 0.5 grams of protein per scoop. So I usually add 2 scoops to my fat-free milk, and you can do it with water or whatever you prefer. The vanilla is good to mix with all kinds of stuff, blueberries and strawberries or whatever you want. I put bitter apricot seeds in mine because it helps, people believe that it helps fight cancer because it creates B17. So there's all these little things you can do to your protein supplements to help boost even their natural effectiveness. But protein is the building blocks of health, tissue, bone, muscle. You need it to heal from surgery. I give it to all my patients after surgery. You need it to build muscle. You need it to build, you know, a healthy body in general. So protein is really important. And most of us need about at least a gram of protein per kilogram. People that are working out regularly probably need a gram of protein per pound of body weight every day to build enough. And protein is key. So
true. Hey guys, this is an impromptu video. We're doing production here with Media Digital Source and other colleagues as well too. But I get asked a lot of questions. The past 18 months, I can testify. I pivoted my whole health, did everything I possibly can. I adjusted to the environment to be secure for myself, for my daughter, loved ones, friends, whatever the case is. I can only encourage you. I'm a student of the game. I ask experts all the time because of my industry. I know a lot of doctors. I highly encourage this. I'm gonna post the website to where if you want to purchase online, there's an online store and everything else. Thank you so much, brother.
thank you. God bless you guys. Be safe.